This segment is sponsored by Golden Triangle Internal Medicine and Geriatrics.
Hey, Southeast Texas, thank you for joining me for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. We do have one question for today. I do take a cholesterol medication and hear concerns about checking your lab work. Certainly, high cholesterol medication has been around for a long time. We love the group called statins, S-T-A-T-I-N-S. You know them better as atorvastatin, Lipitor, Crestor, etc. That is a very commonly prescribed medication, and it seems like every time I look up, they're wanting us to prescribe it more and more. These are good medications, they are effective, and they do reduce your chance of having a cardiovascular event, such as a stroke or heart attack, which again, America is still struggling with. It's still the #1 issue in our country. So these cholesterol medicines or statins are heavily used, especially with all the diabetes and the high blood pressure out there. It's one of those risk factors that we talk about, such as high sugar, high blood pressure, and high cholesterol. So a lot of people, unfortunately, struggling with their weight and their lifestyle do have high cholesterol and do end up on these medications. When they first came out many years ago, there was a lot of emphasis on checking the liver function on a regular basis. That has relaxed to some degree. We're not seeing the issues with liver abnormalities quite as much. It still can happen. So we still do recommend you get some routine LFTs, which is a basic laboratory work that just about any doctor can order and get some results back the same day. So we used to do it every 3 to 6 months. But sometimes you can go a year. Certainly if you've been on the medication for a long time, you hadn't had any problems. So yes, we'd like you to check it, but not as frequently as we once did. Very good medications, and be compliant with those meds. And if you have any questions on Ask the Doc, give us a call. We'll see you next week. God bless.